We try to give back to the community outside of our hospital walls. Some of the challenges that face the community, one of the most pressing ones is food insecurity. Also, the lack of access to medical care.
I grew up with a lot of community service, my parents teaching me the importance of giving back to the community. I had a passion to help others, and that's how I became a social worker. I am proud of the pantry. We routinely help over 2,000 individuals per month, just at our one food pantry alone. I love coming to work every day, and that's what's kept me here all these years.
How are you doing? Fine, how are you?
I am currently a family medicine resident. When I was younger, when I would see my parents work long hours, and whenever they would get sick, they would not go to the doctor's clinic because the nearest Spanish-speaking physician was a far drive, and that would mean them losing a work day to get medical care. I wanted to kind of bridge that gap and bring more bilingual speaking physicians into the area to where patients could feel comfortable and get the care that they need close to home.
I am a psychiatric nurse practitioner. I see patients through various stages of their mental health.
Hello, my name's Kimberly.
The most meaningful part of my day is the connections with my patients in a time and a moment they don't feel supported and they feel like they have no one to turn to, and then seeing them come back and say, you know what, I feel a little bit better.
I love being an oncology dietitian because every day is a new challenge. I help patients and their loved ones fight cancer by helping them nourish them through their journey. I've always been very interested in nutrition ever since I was in high school. I lost my father to cancer when I was 4 years old.
I first saw my PCP to lose weight, and I realized I was 45, so we talked about colonoscopy. I was diagnosed with stage 3 colon cancer. It's not something I want to go through, but I'm here, I'm feeling good.
My parents have been in and out of the hospital since I was little. I saw how they were treated. I loved how people were able to make them feel comforted while they were in a very vulnerable situation.
Is it the liver transplant that you need?
Care management is looking at the patient very holistically. We just pay attention to all of the barriers that may be getting in the way, and then we create the care plans with the rest of the interdisciplinary team to make sure that we can achieve their health, their wellness goals, what's important to them.
We are part of this community. These are our families, these are our friends, these are our neighbors.
We can help families more than just what's related to the medical condition. Without the assistance, the whole family struggles. Working together with community partners helps us help the most amount of people possible.
You want to have more help towards patients in terms of the preventative care. If you can prevent diseases from getting to their worst, then the patients get the care that they need earlier on and can live happier, longer lives.
I've cried with patients because I feel that it's human to let them know that it's impacted me as a human. To have a mental health provider, it's extremely important because it provides the community with access.
Serving allows you to feel like you have some worth, that you are able to make a change. It matters to show up for the community.
I think it's important for humanity to take care of humanity.
A good hospital is one that goes above and beyond what they need to do for the patient.
Hospitals have always been anchor institutions in the communities that they serve. We care deeply about our patients and their outcomes. Our patients tell us time and time again that I don't know what I would have done without you.
I just can't imagine getting better care than here. The cancer is gone, thankfully. Thank you from the bottom of my heart, because I might not be here in a couple years if it weren't for them.
Healthcare workers have to answer that call. You have to be that steady beat in the time of chaos. And people need to know that that hospital is unwavering. This is who we are.